Hi, my name is Crystal Hepp, and I'm an assistant professor at Northern Arizona University. My team was fortunate enough to have our pilot project funded to examine neonatal opioid withdrawal syndrome in Arizona from 2010 through 2017 by the SHRC RCMI. So briefly, our workflow was such that we first requested for electronic medical record data from the Arizona Department of Health Services, and that resulted in about 643,000 maternal records and 658,000 infant records. And then we used insurance diagnostic codes to identify neonatal opioid withdrawal syndrome in infants, as well as opioid dependence in mothers at the time of giving birth. Then we stratified these populations by race, ethnicity, insurance, marital status, and we also looked at length of stay and total charges to better understand the burden on the hospital system. After that, we performed statistical analysis to better understand if there were significant deviations in either the mother group who was opioid dependent at the time of giving birth or infants who had neonatal opioid withdrawal syndrome. And from this slide, what you can see with the highlighted bits is that non-Hispanic white mothers and infants tended to be in our populations of interest more frequently than expected, as well as mothers and infants who were insured by Medicaid. In addition, we found that length of stay for both infants with neonatal opioid withdrawal syndrome, as well as mothers who are opioid dependent on opioids at the time of giving birth, the length of stay was significantly higher, and total charges were also higher for these populations. We also looked at marriage and marital status, and so we stratified the maternal population by marital status, and we found that mothers who were unmarried at the time of giving birth were more frequently opioid dependent than we had expected. And we suggest that marriage could be a proxy for social support and propose that additional support systems may benefit mothers in this population of interest. Finally, we also stratified the maternal group by geographic primary care area, and we found that there were 14 different primary care areas in Arizona that had a higher number of mothers who were opioid dependent at the time of giving birth than we would have expected based on the entire population. So we suggest that when considering where to implement strategic interventions, that these locations be considered. Thank you to everybody involved, as well as the Arizona Department of Health Services, who provided the data sets for us to analyze. Thank you.